city of Mentor to do this program for you all tonight. My name is Rae Grady, and I work for the Lake County ADAMHS Board, and that is the Alcohol, Drug Addiction, and Mental Health Services Board. And we are the county government agency which is responsible for planning, funding, monitoring, and evaluating all of the mental health services and the addiction recovery services that are provided in our county. We actually exist by state statute. So there are 88 counties in the state of Ohio, and every county is mandated to have a board which manages those addiction and mental health recovery services. I'm very happy to point out that our board, I think, is very distinctive in that the majority of our funding now comes from right here, from local tax dollars, from folks who live in Lake County and who believe that people struggling with a mental illness or some type of addiction should get the help that they need, and that their families who are also struggling with that same illness should also get services provided to them so that they can manage what's happening with their loved one. We are very grateful to our Lake County voters for our support over the years, and we're here today actually because we have a partnership with Leadership Lake County to reach out to businesses and organizations around the county to provide information about the opiate epidemic. We really believe that the more folks understand what's happening with this epidemic, especially locally, and get familiar with the kinds of resources that are available, the more likely that they are to help someone get connected to the treatment that they need. And we are, by the way, today talking about an illness. This is a disease that affects the brain, so kind of keep that in mind as we go along. So you folks are all residents of Mentor, but you wear many other hats. Many of you are parents, maybe grandparents. You might be coaching a team. You might actually be a part of a service club or have some other connections with your friends and neighbors. So what you learn from this presentation, I think, will be something that you could share with other people. So if you happen to come across someone that shares with you that they might have a struggle with opiate addiction or any type of addiction, or are in need of a mental health referral or appointment, you might have some idea of where to go for those kinds of resources. All right, so we're going to talk about substance abuse disorder. Oop, I went the wrong way. How about if I do that? Okay. So we're talking today about addiction. Just a little kind of a 101 about addiction. Addiction is really a chronic illness. So it's very similar in many ways to diabetes, which is a pretty common illness that we are familiar with. That's a chronic illness. So chronic means it is long-term and it's manageable, but it's not curable. So when we think about the kinds of things that somebody with diabetes maybe might need to do to manage their illness, can anybody in the audience tell me something? What do people have to do to manage their illness?
Lose weight.
Lose weight, okay.
Eat less carbs.
Okay, eat fewer carbs, yeah. Maybe medication, maybe looking at their diet, maybe getting enough sleep, doing lots of wellness kinds of things. If a person doesn't do those kinds of things, their symptoms can return, and they could potentially suffer some pretty serious health consequences. So think of that when we talk about addiction, because addiction is a chronic illness, and there are things that a person needs to do in order to manage that chronic illness. The first of those things being they need to stay away from mood-altering chemicals, but they need to get connected with good support resources, treatment options. For some folks, medication can assist with them in terms of managing their recovery, and it's very important that they stick with that. On the other hand, if a person stops following that program, we don't typically say that they are weak or that they are someone who's a bad person. What is actually happening is that they have undergone a relapse, and we need to help them get back connected with their treatment program and help them get things back on track. All right, so that's why when we talk about this as an illness, we understand that there are certain common symptoms for this illness, and those symptoms are in place and are pretty typical regardless of what the chemical might be that person might be addicted to. Unfortunately, it is a progressive illness, so it tends to get worse over time without intervention. And it's also a fatal illness. It has the potential of being fatal. And that's what we're seeing right now in terms of the number of overdose deaths that are happening with the opiate epidemic. So if you look at that last blurb there, about 80% of folks who are addicted to heroin will tell you that they began with using prescription drugs. And for most of them, for the majority of them, that prescription drug was an opiate, a painkiller. Right. Well, we don't have any single predictor of who might become addicted. We're pretty sure that there are some certain risk factors. Trauma is a big one, especially early childhood trauma. A family history of having addiction raises the risk for some folks. And what we know for those folks using heroin, a big risk factor for them was that first use of those prescription drugs, which carried a very high risk for becoming addicted. So let's look at some numbers here. Okay. Excuse me, I'm learning the computer here. All right, so about 1 in 7 adults will experience a substance use disorder in their lifetime. And if we look at that pot of people, that 1 in 7, only about 10% of those folks actually go on to get treatment. So part of our job here tonight is to get comfortable with having a conversation with someone and sharing with them the resources that we might have available for them here in our county, so that maybe we can raise that number a little bit. All right? Unfortunately, right here in Ohio, overdose death is the #1 cause of accidental death in our state. I think that's fairly typical for many states around the country, but Ohio really is the epicenter for this epidemic. And we have been in the top 3 for overdose deaths for several years now. And if we're looking at sort of a day-by-day rate, about 14 people a day in the state of Ohio will die by overdose death. And to put that in perspective a little bit, about 1.5 years ago when we were doing this presentation, that number was 8. So we've progressed along those lines. This I think is interesting because this gives you a little bit of a picture about where we are in the United States in terms of our mindset about medication. We really are a pill-popping society. We have a climate where we expect to have a quick fix on things. And when we're looking at the opiate epidemic, take a look at those numbers. The one that's most sobering to me is that 99% of the world's Vicodin is being consumed right here in the United States. And yet we are less than 5% of the world's population. So we are really the nation that has the highest risk for overdose and is doing the biggest amount of consumption for opiate painkillers. About $442 billion every year is the cost to our society in terms of substance abuse and its impact on our culture. Most employers are looking at that in terms of their bottom line. So how does that affect an employer? Well, folks who are abusing medications, folks who are using drugs are more likely to be tardy. They're more likely to have more absences from work. They tend to have more accidents, and not just car accidents, but machine shop accidents and other types of things that they might be responsible for, construction accidents or whatever. And their productivity generally falls, so their job performance is not where it used to be, and they affect most of the folks around them in terms of those kinds of things. So let's take a look a little bit at our actual topic here. We're talking about the opiate epidemic. So I want to make a distinction between opiates and opioids. An opiate is a natural substance. It comes from the poppy plant. It's typically the resin from that plant that is used to manufacture substances such as morphine, opium, heroin. On the other hand, opioids are synthetic versions, so they're lab-created versions of those kinds of drugs. things like oxycodone, Vicodin, Percocet. Those are all manufactured opioids, pain medications. But in general, those two substances, the opiates and the opioids, do the same thing to the body, and they bind to the same receptors that we have in our brain. So they give us a feeling of euphoria, or that's that high that comes with that. They relax the muscle system. They give people a sedation so that they put you to sleep. And unfortunately, they depress a person's breathing response. So that's actually what is happening when somebody overdoses. Their system is affected by that opiate. That opiate has entered the receptor in the brain, kind of like a key fitting into a lock, and has shut down that person's breathing response. So when someone overdoses, and we have our EMS folks rushing to the scene and administering the drug Narcan or naloxone to bring that person back, what they are doing is unlocking the key from the lock. They're taking the opiate effect from that receptor and restoring that person's breathing response. Unfortunately, Narcan can wear off in a fairly short period of time, about 15-20 minutes or so. So if a person has enough of that drug in their system, or that drug is something very powerful, like fentanyl, we're seeing a lot of that now, the Narcan may wear off, and that person may slip back into that overdose. So that's one of the reasons why you may see on the news sometimes stories where someone took maybe 5, 6, even 10 or more doses of Narcan to keep them breathing until they could get to the hospital to be stabilized. So those are things to keep in mind. So let's talk a little bit about how we got to this situation that we're in with the opiate epidemic. Over the years in the United States, we have sort of a long history with drugs. And many of them have actually been legal in our history. So if we look at the drug heroin, which actually was first produced by the Bayer company, and it was manufactured and put out there as an alternative to morphine. It was advertised as being something that was less addictive and much more helpful for pain relief. Now that we know it is much more addictive, and we have learned our lesson with that, and so it has become one of the substances that is illegal and considered an illicit drug in the United States. But even in bygone days, people were even using things like cocaine and rubbing it on babies' gums when they were teething, or mixing it with alcohol in certain suspensions and going from town to town and touting that as a pick-me-up or an energizer. So we don't do any of those things anymore. We have learned that those drugs are dangerous and addictive. But kind of keep that in mind as sort of a backdrop for our epidemic. The other thing that has happened is we are doing a lot of advertising. The prescribers, the prescription companies actually are doing a lot of marketing to consumers for drugs. And we are one of only 2 countries in the world that actually allows that type of direct-to-consumer marketing. And this really raises the risk for folks to be kind of gotten hold of. It's really not thought of by most of the other countries around the world to be a good idea to be marketing heavily pharmaceuticals to people and then having people go to their doctors and asking for this drug or that drug or whatever. So again, this is a piece of our culture that has kind of put this expectation that folks have that we are folks who just need a quick fix, and we need our prescribers to take care of those kinds of needs for us. So the only other country is actually New Zealand that does that. A few other things that have happened over the years. Back in the 70s, President Nixon started the war on drugs. Then we had the 80s, where Nancy Reagan came along and had her Just Say No campaign. And I used to work at Crossroads many years ago, and I still remember some of those little kits that we used to have to go into the after-school programs and do activities with kids around that whole Just Say No campaign. What we learned is that you can't just tell children to just say no. We need to help them practice more refusal skills and give them a language for being able to respond to real-life situations. In the 90s, we decided that the way to get out of the situation with drugs was to put everybody in jail. And we have learned that that doesn't really take care of the epidemic either, right? And then the last thing that came along that's most connected with the opiate epidemic is in the early 2000s, the medical society and other folks decided in the medical community that pain should be considered the fifth vital sign. So you go to your doctor, you get your blood pressure checked, your temperature checked, your heart rate, all of those things that have a number to them, right? So there's our hard science behind those vital signs. With that fifth vital sign, what folks were being asked was, on a scale of 1 to 10, tell me how your pain is today. Put a rating on that. That's not a hard number. That's a very subjective type of thing, isn't it? So what's a 2 for me might be a 5 or a 6 for somebody else. You know, how many people in here have gone into an urgent care and you see the little plaque on the wall that has all the little smiley faces all the way down to the frowny face? Again, that's that scale. Rate your pain. So as a patient, you know, what's sort of our expectation with that? We want that number 10. We want the smiley face. And our expectation is that that provider, that doctor or nurse practitioner is there to make sure that I get that smiley face. So what happened with this, we had this expectation for having no pain, and at the same time, the pharmaceutical companies were introducing very powerful opioids. Purdue Pharma in particular introduced OxyContin. And there was an advertising campaign which minimized the risk of addiction for that drug. And some may argue that they also put a lot of pressure on prescribers, maybe even offered them incentives so that the more pills they prescribed, the more incentives that they got. So that perfect storm came together. Our expectations, the fifth vital sign being pain, and the availability of a very powerful and significant opiate medication, which folks began to be prescribed for fairly common types of ailments. So a drug that was initially designed to be prescribed for someone who has maybe very severe cancer pain or other very severe types of injuries maybe coming into the ER from an accident, now is being prescribed for folks who might have a toothache, somebody who might have some ongoing back pain issues, other kinds of things, without good science behind it saying that that was a good thing to do. Okay, so we understand that? All right, fentanyl. Fentanyl is a drug you probably have heard about. It's been in the news quite frequently lately. Fentanyl is another opioid. It's manufactured in the laboratory. It is a painkiller. It was originally designed for very heavy-duty cancer pain, and it has broken out now as a drug which is being laced into marijuana. We're finding heroin laced with fentanyl, fake OxyContin pills that actually are most, if not all, fentanyl. And fentanyl is 50 to 100 times more powerful than morphine. So if you could see the vials there, just those few tiny grains of fentanyl right here, you take a look right here, they're just a couple grains of fentanyl. This would be equal to about this amount of heroin. So pretty powerful, right? Actually, the Food and Drug Administration just approved a new drug, Desuvia, I believe it's called, which is even 100 times more powerful than that. So, all right. So, one of the difficulties for us to keep up with these things are that many new psychoactive substances or drugs are coming on the market every day. Different analogs or versions of fentanyl. There are about 50 different ones that we know of. Even Lake County Narcotics is identifying new analogs on a fairly frequent basis. And other things that are happening with this epidemic are that sometimes some fairly unscrupulous people are taking advantage of people who have an illness and their families that are in a lot of pain. And so we see these practices popping up, cash-only Suboxone clinics, patient brokering, where they persuade someone to go to a treatment center and away from family and friends, max out that person's insurance or Medicaid, and then turn the person back out on the street. So those are things that are happening all across the country. I believe 60 Minutes even had a special program on it not too long ago, just focusing on one county in the state of Florida that had over 800 treatment centers. And looking at the business practices that they were operating there. So I encourage you, if you have any types of questions about these types of things, that you have information about from someone and you have a question, you can always call the Lake County ADAMHS Board for information about those kinds of things. All right, so what are we doing locally? We have an opiate task force which was started back in 2010. It has a representation from many folks in the community, law enforcement, the health community, teachers, all of the health district, many different folks there who are all working together to try to address the epidemic here in our county. And I think we have actually done some really good things. I brought some resources with me tonight. They're on the back table. There are a number of publications that we have available for folks. So any of you that might be listening in, if you're interested in any of these types of pamphlets or brochures or information for organizations that you might be involved with or schools, just call the Lake County ADAMHS Board in Painesville and we'd be happy to hook you up with some of this stuff. So this one in particular, I want to point out warning signs of potential drug and alcohol abuse in teens. There's some very good information in there which tells you how to start a conversation with a young person, what to talk about with them, and there are lists of some signs and symptoms, things that you might look for, physically, behaviorally, those kinds of things that might be an indication that someone might be using drugs or alcohol. Okay? Right. Another couple things that I brought with me, I have some drug disposal cards, and they list the 7 locations around Lake County where there are drop boxes where you can take your unused prescription medication. I don't know about you, but my medicine chest in my bathroom does not have a lock on it. So if I'm keeping a bottle of unused medication in there and I have someone come over to clean my kitchen or seal my driveway or paint my living room, anybody who's in my house and uses that restroom has access to what's in that medicine chest. And I don't usually go back and open it up and check and count the pills to see if any are missing. We don't usually do that. So I encourage you to get rid of any old unused medication that you have. You can take it to one of these 7 locations. The bins are in full view at the police departments and the sheriff's department. You just take that bottle, blot out your name with a magic marker, and dump the whole thing right into the bin. The other option that you have is something called Datura. Okay, this is a product which is available online. We also have these at the Lake County ADAMHS Board. We have a grant to disperse these around the county. This product is something which is biodegradable. So what we don't want folks to do is to take their meds and put it into the trash mixed up with kitty litter or coffee grounds or those kinds of things, because that medicine gets into the groundwater and contaminates the environment. This product is a good alternative for that because it binds that medicine and deactivates whatever the chemical turns the whole thing into a gel, and this you can put into the trash. So you would just tear off the top, dump the pills into the bag, and this bag holds about 45 pills. You would add warm water and let it breathe for a minute. It's going to fizz a little bit and maybe even expand. You don't want to close off the top. You want to give it a minute or so to breathe. Then you're going to seal it up and shake it, and then you can put this whole thing right into the trash. So this is something that maybe you have an elderly relative who can't get out to one of those Dropbox locations, or the weather's really bad and you'd like to just use this. These are products which you can get online, or you can call the board and we can bring some out to your facility. Okay? All right. So let's talk a little bit about the good news. Since we've been collecting, since 2010, over 42,000 pounds of medication has been collected just here in Lake County by this program. So I think we're doing a lot to save the environment, but also to get medicine out of the hands of children, teenagers, anybody else who might have access to that medication through folks in their medicine chests. Okay. I do want to point out that as we look at the opiate epidemic, the trends are saying that we have about 41% fewer prescriptions that are being written now in our state. We have a law in place now which restricts the number of opiates that a physician can prescribe, so that's a good thing. That's contributing to the lower number of prescriptions. We also have a system called ORS. This is run by the pharmacy board, so that if I go to a doctor and ask for a prescription for an opiate for a back pain, he's going to put my name into that system, and up is going to come every single prescription that I have been prescribed. So that physician is going to be able to tell if I've been doctor shopping, if I've just had a prescription written 2 weeks ago, and take a look at my history. One of the things doctors are also being encouraged to do is to have conversations with their patients about their addiction history. Do you have addiction in your family? Do you personally have a history of addiction? Let's have a conversation about what kinds of medications might be available. We are not here tonight to tell you not to take your medication if it's been prescribed. But we do want you to have some good conversations with your providers ahead of time if that's possible. Talk about the kinds of things that are available to help with pain. Are there things that are available for them to prescribe you that are non-addictive? Are there some alternatives like ibuprofen, exercise, water therapy, acupuncture, all of those kinds of things? And talk with your prescriber about what is their plan. If they do give you this prescription for an opioid, what's the plan for helping you to step down off that medicine in a safe way? And what might be some signs, withdrawal symptoms that you might look for so that you could be prepared for that. So that's a really important thing to do. Okay, we're going to switch over for just a minute and talk about one other trend that's happening, not just in our county, but all around the United States. And that is the trend of young people using vaping devices. So we're talking here about e-cigarettes. So e-cigarettes are battery-operated devices which produce an aerosol by heating a liquid. So some of the names that you may have heard are Juuls, e-cigs, Ends, Mods, Vapes. They have a number of different names, right? Today, just now, vaping is a $3 billion industry in the United States. As a matter of fact, Juul, which is a manufacturer of a particular vaping device, has just gone into contractual agreements with Altria, which is the company which produces Marlboro. And they are looking at ways that they can market this product on a larger basis. So some of the projections that we see in the future are that by 2025, this vaping industry may be up to $60 billion. So that's a lot. So just the basics about the devices. There is a power source, which is the battery. The battery heats the coil or the heating element. It's called an atomizer, which then heats that liquid solution that is present in the device. And those can be refillable cartridges or they can be disposable pods or cartridges. One of the things that's very concerning, not just to us at the ADAMHS Board, but I think to many people around the country, it's pretty obvious that vaping devices are being marketed to young people, to our kids. Companies which produce cigarettes, their sales have dropped in the United States over the years because more and more people have quit smoking. And I think this is a way for them to take a look at how do we replace that source of funding by using a nicotine product. So the devices are designed to be very easy for kids to hide. So it is legal in the state of Ohio for a person who is 18 or older to buy a vaping device, right? So if I'm using a vaping device and I'm walking around the city of Mentor and a police officer sees me, I'm not going to get arrested, right? So I have no reason to hide that device, do I? So what would be the rationale for developing something which looks so much like a cartridge that we use in our computer, a flash drive? In fact, there have been some studies that have done where they have actually shown adults a flash drive and a device like that Juul and have asked them to tell the difference, and they couldn't. They couldn't even identify that the Juul was a vaping device. So what do you think? Does it strike you that adults don't need to conceal this device, but who might? A young person, right? Somebody who's using this device in school, maybe in the back of the classroom, or in the bathroom, or even walking down the hallway. They're putting it in their pocket, they're keeping it in a place where if it gets looked at, they're hoping that an adult won't recognize that this isn't actually a flash drive, it's something else. So concealment is the goal here. Another thing, we have about 7,000 different flavors that these cartridges can have. I don't know many adults who are looking for bubblegum flavored cigarettes or vaping devices or mango flavor. And again, we're looking at marketing to kids, to young people who are very attracted to this kind of thing. Concealment, again, sort of a goal here. Okay. Juul, which is worth about $38 billion now, is basically replacing old cigarette buyers with new users. Strategies here are definitely to replace adult smokers with teens. Right. So e-cigarettes tend to cost less than a typical pack of cigarettes, except maybe the first time that you buy the actual device. Young people tend to know folks that they can buy pods from or cartridges from on a cheaper basis. They may even be getting some things over the internet off the black market. So we're concerned about access for young people. So why do you think young people are using vaping devices? Because these devices originally started out as a tool for adults who are trying to quit smoking to actually use in order to support that quit, right? To support their efforts. Now we have all these young people that are using. Many young people across the United States. So much so that the Food and Drug Administration today is talking about putting some very strict guidelines on these devices to maybe even potentially ban their sales down the road. And actually today, San Francisco, California, they are in the process of framing and attempting to pass an ordinance which would ban the sale of e-cigarettes completely in the city of San Francisco because of their concern about how many young people are using the devices. So why are kids using? There are a number of reasons that you can see up there. Young people are curious, they're attracted to the flavors, they might want to do it to fit in, there might be peer pressure. Some young people have shared with me that maybe if they have some uncomfortable feelings, not feeling good about themselves or things that might be happening in their lives, that they might be using that to try to de-stress a little bit. And there are competitions that kids are looking at on the internet of people using those devices and doing pictures with the clouds of vapor. So it's attractive and it's fun. Unfortunately, there are under the impression that these are safe devices, and we do know that the devices are often used to vape THC, which is the chemical in marijuana responsible for the mind-altering effects, and other kinds of drugs are being used as well. In many places around the United States and even here in northeastern Ohio, we have law enforcement folks that are actually identifying devices that have other illicit drugs in them, such as methamphetamine or even other hallucinogens. So not just a a vapor that's kind of less harmful. So here are the things that kids think about vaping. They believe it's just water vapor with low levels of nicotine, if there are any. And actually what we know is most vape pens do contain nicotine, and Juuls in particular. One pod in a Juul has about as much nicotine in it as a pack of cigarettes. So it's about 20 cigarettes worth. So depending on how much you are using that device, how much you are taking in that vapor, some young people are going through one pod in a day or even a half a day. So they're being exposed to quite a bit of nicotine. We think that maybe kids think that they would be able to tell if the pod that they're using or the device they're using has been tampered with and somebody has put some other type of liquid in there or some drug in that liquid. And we definitely know that that is not true. Most of the things that are out there are being tampered with in terms of buying it secondhand off of people or buying it through the black market. And folks really don't have good ways of knowing those things are there unless they take it apart. Just some other quick facts about vaping that we do know now. Vaping weakens the immune system. We know that young people who start vaping are 4 times more likely to transition over to cigarettes. And in fact, many of them are doing both. They're vaping and they're smoking cigarettes also, which raises their risk for developing long-term illnesses like heart disease and cancer. And nicotine is quite a powerful drug on that developing adolescent brain. Once that young person is addicted to nicotine, it's very difficult for them to stop. And most of the efforts that we have right now in terms of consequences for young people are fines or detentions or things of that sort. What we haven't done a good job yet with and put in place are some follow-up for young people to help them to quit that habit as quickly as possible so it doesn't result in a long-term addiction for them. And think about the research. You know, we spent many, many years gathering the research about how cigarettes damage health. So we can say that smoking damages the heart, that it causes cancer, heart disease, stroke, all of those kinds of things. We haven't had this around long enough yet to do that kind of research. So when a young person says, you can't tell me that this causes cancer, that may be true, but I always add the word yet, because it's sort of a work in progress. And we're just beginning to find out that even young people who do vaping on a regular basis are showing up in doctor's offices and in emergency rooms with many different lung problems. So it's really important to have a conversation with your young person about vaping. Never too early to do that, to make it known what you expect from them and to give them the facts about this. Ask them what they think about it. Ask them if they know anyone vaping. Not naming names, but are their peers using these devices? And what do they think might be some of those reasons? And then begin to talk to that young person about some language they can use to, if they're put in a situation where that is offered to them, that they have some practice using some actual words to be able to say no. So we don't want to just say to them, just say no, because that doesn't work. We want to practice with them some actual words, some sentences, give them some excuses that they can use so that they don't lose face in front of their peers. It's very important to them that they fit in, that they be confident, and that they have some good reasons for not doing those things. All right? If a teen does admit to a parent that they have tried vaping, it's not real productive for us to be shocked or to be angry, but to maybe talk to them about health concerns. And what can we see as an alternative? What are some of their reasons for why they started? Or why are they continuing? And what are some things that we can do to help with that? And then maybe to think about some referrals for cessation programs so that we can really get some intervention going early on. And also, it's really important for us adults to be role models. So we cannot be telling our young people that this is not something that we want them to do if it's a behavior that we're engaging in, right? Now, they pay attention, not to so much to our words, but to our actions. So it's very important for us to do that. Okay, I'm going to wrap this up by just sharing a couple other resources. If you are looking for any type of mental health appointment, or a counselor of some type for a mental illness or an addiction, or you're looking for other addiction resources, the Lake County Compass Line operates 5 days a week from 8 to 4:30. The line is answered by a trained triage specialist who can talk to you about where you live in the county. Do you need transportation? What kind of program or counseling are you looking for? Do you have insurance or not? And by the way, lack of insurance is not an obstacle ever for somebody getting treatment in our county. That's really important to understand. So this is a good place to start. Most people don't want to call 5 or 6 different agencies and tell their story over and over again and then get put on somebody's waiting list. If you call the Compass Line, this can short circuit that and can really help the person to get connected to the kind of help that they need pretty quickly. So this is a good number to keep in mind. Lake County has an excellent network of treatment. We have a couple programs specific to opiate abuse. The Quick Response Team, or QRT, is a program where we contact folks who have actually experienced an overdose and have survived and gotten stabilized. We will have a team of a police officer, an addictions counselor, and a EMT or paramedic go out and call on that person. And they don't wear their uniforms, they don't roll up in a squad car so that the neighbors are looking out of their window. They're just stopping by to offer that person some resources for them to get into treatment. So that's a really excellent resource that we've had in place for about a little over a year now. We also have an ORT, an opiate response transition program, which operates out of both the emergency rooms at Tri-Point and at Lake West. So if a person is struggling with an opiate addiction, they can go into the ER and ask for some help, and we have a team there 24 hours a day to talk to that person and begin to evaluate them to see if they are particularly well suited for the ORT program. So, and there are a number of other treatment resources in the county that you can access by calling the Lake County Compass Line. If you know anybody who is struggling, please reach out to that person and share those resources. Or you can even make a call yourself to the Lake County Compass Line just to ask questions or to get some additional information. Certainly if somebody is showing signs of overdose, you want to call 911 immediately, because we want to get that person help as fast as we can. We also do have a crisis hotline in Lake County, particularly suited for mental health emergencies in particular, and that number is 440-953-TALK. And it operates 24 hours a day, 7 days a week with those crisis services. Do we have any questions from the audience? Okay, I want to thank you very much for listening. On behalf of the ADAMHS Board, I want to thank the City of Mentor for letting us present this program tonight. Thank you all.